Good evening and welcome to the July edition of the Business Forum. On behalf of all the members of the Niceville Valparaiso Chamber of Commerce, I want to welcome you. We've got a great show. We're going to kick off with our August second Wednesday coffee sponsors, and you want to hear all the wonderful things they have to tell you about what's going on over at White Wilson. And then we're going to talk a little bit about Leadership Okaloosa, and as a graduate of Leadership Okaloosa, you want to make sure you stay tuned for that. And finally, we're going to tell you what our education committee's got going on. So stay tuned for the entire show. But first up, I have Dr. Connie Richardson, Family Medicine, and Dr. Richard Reno, Pediatrics with White Wilson Medical Center. Welcome.
Thank you, Dave.
Thanks.
Good to have you both on the stage, and thank you very much for taking the time out to come on the show. I guess we're going to start with Dr. Richardson. Could you provide us with kind of an overview of what White Wilson has services that they offer?
Okay, well, we have at least 20 specialties, and we also have lots of primary care with family practice, pediatrics, and immediate care. We have offices in Fort Walton Beach. That's our main campus, so to speak. And then we also have offices in Destin and in Niceville. Those are our satellite offices. And we have in-house lab and radiology at the satellite offices as well.
Oh, wow.
And then we have the much larger radiology and lab at the main campus.
That kind of shortens the time required to get things done, doesn't it?
Immediately, yes. Patients love to come in, and if they need a blood work, they can do their labs there. If they need a chest x-ray or whatever, or an x-ray of their arm, elbow, knee, whatever, we do that right there. So it makes it so much easier and much more convenient for them.
Dr. Reno, near and dear to my heart, you have a beautiful office in Blue Water Bay. Could you tell us a little bit about that?
Yes, our Blue Water Satellite Clinic is the home of several specialties. We have a strong family practice group there, internal medicine, we have a pediatric group, and our ophthalmologist visits out there periodically. We also have in-house, as Dr. Richardson was mentioning, we have in-house radiology and lab, which adds a real capability to the service we can provide to our patients, and the speed at which we can get information to take good care of them.
Oh, absolutely. It may save them a second trip, I wouldn't doubt.
Oh, absolutely.
On more than one occasion.
And that's the question we get, when we say, oh, we need an x-ray, the patients say, can you do that here? Oh, yeah, we can.
Yeah. Dr. Richardson, folks talk, especially my teenagers were talking about going into medicine, and that seems like such a long and arduous process, and sometimes it's difficult for folks to figure out how to get started. How did you get started in medicine?
Well, I wanted to be a doctor probably since I was in second grade, so that's what I always wanted to do. I did my undergrad program, and then I went to the University of South Alabama, Mobile, for medical school.
Sure.
And then I did my residency. Family practice residency is 3 years, but residency programs vary from 3, 5, some even, if you're going to subspecialize, 8, 10 years. Can be a very long, arduous journey.
Oh my goodness.
But family practice was 3 years, and it was great. I did it in Columbus, Georgia, out of the Emory office. And it was wonderful. We were in a small hospital. Well, I shouldn't say small hospital. It was about 700 patient load, but you were the only residency program, so you did everything. So it was wonderful. Great experience.
That is fantastic. And maintained all the way through. I guess once you get on the train, just don't get off.
Exactly.
Is that the key you would pass on to somebody that's watching?
Well, that, and in fact, I've got a medical student who's with, well, she's pre-med. She's with me now. She's from the University of Florida. She's working with me this summer. She comes 1 day a week, and she's kind of learning how to do family practice, and she's kind of looking at the office setting and how all that works. And
there's so much to it.
There is. But you really want to do your pre-med kind of in biology and chemistry and the sciences.
Dr. Rena, tell me a little bit about your practice and how long you've been with White Wilson.
Well, I'm kind of a newbie there. I got on board last November, and like Dr. Richardson, it was kind of a circuitous way to get here. We both were in private practice at one point in time. I did military service, and this opportunity came up, and we just jumped on it.
What a wonderful place to live, isn't it?
Well, I'll tell you what, you just can't beat it. We used to vacation here, and so the thought of living here was just kind of a, never really came up, but didn't really think it was possible. But this White Wilson Medical Center offered us some very unique an opportunity.
Sure.
And we're both very blessed to be on board.
Amen. Amen. And Dr. Richardson, tell us about your practice at White Wilson.
Well, family practice, we do from small kids all the way to, I have a patient who's 102.
Oh, Lord.
So
You're running the gamut, all right.
So we have the full gamut there. There's 3 family practitioners in our office. There's myself, Dr. Gwinnett, and then Dr. Yang. So we're all there together. In fact, Dr. Gwinnett and I try to coordinate our time off. If, like, we were off for 4th of July, I took a couple of days off the beginning of the week. She took a couple of days off the end of the week, so we can cover for each other. So it works out great. We're in the office. We have the electronic medical record now, which is fantastic. So we can look at labs and test results and
real time
refill prescriptions and everything all online, even from the convenience of our home at night.
How
So
fantastic
it's
is
wonderful.
that?
Yes, it's wonderful.
Work comes home with you, isn't it?
Yeah, usually till 11 or 12 o'clock. Yes, but
quite
that's
the
okay.
benefit there. Quite the benefit. Dr. Reno, how did you get started in medicine?
Like a lot of my colleagues, I had an idea early on that this would be a profession. I wanted to be a fireman first, but
yeah,
I was real young.
I wanted to be an ambulance.
Exactly, exactly. But it's as with anything, there's a context issue. As early on, I think a lot of doctors or to be look at that more of as a goal.
Yeah.
And more from an academic standpoint. But once we actually get into medicine, we realize, man, this is a great field.
Yeah.
I mean, there's just.
And you're specifically pediatrics. Tell us about that pediatrics clinic at White Wilson.
Well, our pediatrics clinic, there's 12 pediatricians in the White Wilson system, and there's divided into the 3 campuses, and all super people, a lot of talent there. At the Blue Water facility, specifically, there's 3 pediatricians, Dr. Summers Vadlamani and myself, and we run our clinic Monday through Friday from 8:30 to 4:30, and we have a Saturday morning clinic.
Oh, wow.
At both the Fort Walton Beach office and the Blue Water office.
Very, very convenient. Very, very convenient.
It is very convenient, and our patients know that if they come in at any point in time, they're going to see either their physician or one that works with their physician, and we all have access, like Dr. Richardson said, to the electronic medical record. We can call up our old notes or other doctor's notes immediately.
Dr. Vadlamani took care of my children very well.
She's wonderful.
Yes, she is. She's
Pass
absolutely wonderful. Dr. Richardson, you have a lot of technology improvements going on at White Wilson.
Yes,
we
do.
Tell us some of those things.
Well, first, the electronic medical record. We instituted that last year. That was a big undertaking, but it was wonderful. So we have all of the records. In fact, patients that have been there from the past, before we got electronic medical records started, all the records got scanned in. So we have labs, from 7 or 8 years ago, exactly, all in the system too. So you can always go back and look at old CAT scans, old MRIs, old labs, all that kind of stuff to look back and
that has to help increase care so much from having
really
to go back and find old stuff and get pull it and bring it and read it and
It really does. I was actually at Martin Army years ago, and we would get these big medical records about this thick, and of course lab radiology would be somewhere in the mix, somewhere in there, but you would spend 20-30 minutes just thumbing through a chart trying to find the records, and everything's right there at our fingertips. And then now we have the new patient portals now, which are starting, so the patients can refill their prescriptions online, or request refills online. They can request appointments online, they can update their health information online, so it's wonderful. It's going to, I think it's just going to make things a whole lot easier and much more convenient for our patients.
Absolutely. Dr. Reno, what do you enjoy most about White Wilson?
There's several levels to that. There's a technical level in the sense that this organization has developed itself to maximize patient care and to really try to help the providers do that. There's a reason that White Wilson has been so successful and has been a name for so long, because there's excellent leadership, and there's an emotional level. This is a great group of people. We work together very well personally. We have social events together, and so that the technical level and the emotional level kind of
meld
together to make a really phenomenal organization.
And from a patient standpoint, the accessibility is just fantastic. With the multiple locations and the hours on Saturday, it fits our schedule, and that's so important to us. So,
And that's why we're here.
Amen.
Exactly.
Amen. Well, thank you both for so much that you're doing for our community, and thank White Wilson for giving you the time to come here and chat with us, and we look forward to seeing you at the second Wednesday breakfast.
Well, thanks very much. I want to say we're both still excited new patients.
Absolutely.
Oh, both. Do you have a phone number they can call for your office? Is that
897-4400.
if they're looking for new patients? Okay. God bless you both, and thank you very much.
Thank you, Dave.
Stay tuned. We have Julie Cotton coming up, and she's going to tell us all about Leadership Okaloosa, and you want to hear about that. So don't go away.